5 past the allotted time. So,
I'm recording now.
so I'll just start the webinar. So, welcome to our 24 viewers at the moment. I think we'll probably increase as we go on. So, this is our first Health Services Research Association of New Zealand, Australia and New Zealand webinar. First, we hope, of many to come. We've already got one lined up for the near future, which will be Nick Black from the London School of Hygiene and Tropical Medicine. So keep your eye out for that one. Just to give you a little flagging a few things that are going on with the association, we're relaunching the website in the coming months, so keep an eye out for that. And our 2 yearly conference is in December. And just to highlight our main keynote speaker, which is Sherry Gleald from New York, who we're very excited to have attracted to the conference. So more information about the conference will be on the website, so keep an eye on the website for news about the conference. Before I introduce Melissa, just a few housekeeping points about the webinar. So as I say, this is our first one, so Sarah's instructed me to ask you to bear with us if there are any hiccups. Melissa has noted that there's a very small probability that she may be cut out, but she'll rejoin as soon as possible if there's a power outage. So you can view and hear the presentation, but you can't speak. But what we'd ask you to do is, if you have questions, is to use the Q&A button on the bottom right-hand side of the screen, and Sarah and I will monitor the questions. If there's points of clarification, we'll ask them as Melissa's talking. Otherwise, we'll save the questions to the end and put them to Melissa on your behalf. The webinar is being recorded. Sarah's going to record it, and she'll post that onto the association's website. And then finally, Sarah's going to send out a short survey just to get your thoughts and comments on how it went and how we might improve webinars in the future, and potential speakers as well. So that's it for housekeeping. So I'd say this is our first webinar. We're really fortunate to have Melissa Sweet, to talk to us specifically about Twitter. But Melissa's, as a journalist, has been working in health and medical issues since the late 1980s. She worked for the Sydney Morning Herald and the Australian Associated Press, and moved into online journalism in around 2007, and she's been working on the Croaky blog, which is a forum for debate and discussion around health issues and policy since around that time. I was looking at the statistics for Croaky, and I saw that last year in 2014 it attracted over 175,000 users, so that's quite an impressive audience that it attracts. But specifically for today, Melissa's credentials are around the use of Twitter. She's posted, I noticed, 95,000 tweets, which is quite incredible, and has almost 12,000 followers. So for us who are kind of dipping our toes into Twitter, that seems an incredible amount. But so I'm pleased to introduce Melissa to tell us a bit more about how she achieved that, and how she uses Twitter that we can learn from.
Thank you very much for the introduction, and also for the invitation to join you all today. Please be patient, because we're all learning in this space, not only on Twitter, but using this webinar. So if there's any questions or anything's not clear as we go along, please type in a question and stop me. I'd like to begin by acknowledging the traditional owners of the land that we're meeting on, and making the point that even when we're in cyberspace, we are on Aboriginal country, and I pay my respects to the traditional custodians, the elders past and present, and to Aboriginal Torres Strait Islander health researchers and professionals who may be joining us today. And you may, if you work in Indigenous health, you may already be familiar with the fact that this sector has really, I think, been at the forefront of harnessing tools like Twitter in disseminating.
What's happened? Oh, are you back?
Not sure. There we go.
Sorry, we
so,
lost.
There you go. So I'm just showing I'm down in this region here, tweeting and communicating via cyberspace. And as I mentioned, in terms of looking to leaders in the field to learn from, I'm just taking us there to the homepage on Twitter of NACCHO. And if you want to, look and learn, I think watching what they do on Twitter, I've certainly learned a lot from, and they've become, great partners and collaborators with me in terms of we retweet each other and share information. And you can see, they're using their Twitter profile there, putting up a photo of themselves with the relevant ministers. So, making a statement there about their reach and influence too.
Melissa?
Yeah.
I can't see your screen.
Oh.
Have you pressed the share screen button?
We could a minute ago.
It was coming up before.
You might need to just set it back up again.
So what should I do there? Hit share screen again.
Yeah.
Is that
starting.
coming up?
Here you go. Yeah.
That's it.
Right.
Yeah.
I'm not sure what I did there, so I hope I don't do that again. But anyway, everyone can see the NACCHO screen there and how they've got, that very strong photo in their banner describing who they are. And if you're not already looking at what they do on Twitter, I suggest it's worth having a look and following them possibly. So now we will go. Has that come up okay, the change in screen?
Yep.
Can you see that?
Yeah.
Good. So this is a UK site, the Research Information Network. There are any number of guides for researchers and people generally about using Twitter in your work. I think there's a very common perception for people who haven't engaged in Twitter that it's a trivial space where celebrities tell you what they had for breakfast. And on that, I must admit, I have seen the former Health Minister, Tanya Plibersek, share a photo of what she and her staff were having for lunch one day, but I still thought that was interesting because it told me something about them. Anyway, this is a site with a guide for researchers on using social media, and I will be sending Sarah and John a list of some of these links so that you will get them all and go away and read them at your leisure. But this makes the point that social media is very useful for researchers in finding, using and disseminating information. It says social media can change the way in which you undertake research and can also open up new forms of communication and dissemination. It has the power to enable researchers to engage in a wide range of dissemination in a highly efficient way. As mentioned, there are quite a lot of guides. This is another one that I think is very useful, again, freely available from the London School of Economics, and it's got very practical tips for using Twitter in research, teaching and impact. So it's a guide for academics and researchers. It's some years old now, but the basic advice from it is very good. And I'll just scroll up so you can see some of the things it covers. It gives advice about how to set up your account. And it's really important when setting up your account to think about, how and why you want to use it. And it gives you tips just for how to get going. And also, like any new world, Twitter has its own language, own terminology. So it gives you a guide to some of the things that will help you get started. For example, if you're following someone on Twitter, it means all their tweets will appear in your timeline. You can also unfollow people if you want to, if you start following someone and find they're not tweeting what you want to, they're tweeting too much or not what you want to hear about. You can also block people. So if you find someone is trolling or engaging in a way that you don't want to engage, you can block people, which means their tweets won't come into your timeline. Retweeting means that you are sharing someone else's tweet, and there's a number of ways to do that, which we'll talk about later. So that capital RT there is an indication that you're retweeting someone's tweet. You can reply to tweets, so have conversations with people on Twitter. You can make these closed and private in terms of a direct message, which is seen only by you and the people receiving it, or you can do it in an open space and then make it more of a wider conversation. Mentions, we'll go to the mentions column later, but that's a very important tool to know about Twitter because it's a way of connecting up with people. For example, at the beginning I was just talking about how I will often tweet into other people's Twitter streams by using either their Twitter handle or the hashtag that they're using to draw it to people's attention. So a way of creating networks and getting information out to people you think might be interested. Hashtag, is one of the important things to know about Twitter. It's a way of categorizing tweets. And we've already had a little discussion about, what might be a useful hashtag for your organisation to use. And I think it's a great idea to do this. Set a hashtag that your members can talk to each other on Twitter with, engage other people in, and just generally create awareness of health services research. So some of the other hashtags, I use SDOH every day, social determinants of health, sharing information about that and tweeting into networks about social determinants of health. I use public health a lot as well. And as I mentioned, there's a group on Twitter, Healthcare Social Media Australia, New Zealand. So their hashtag is the acronym of that, basically. So, thinking about hashtags when you're tweeting is very important. Okay, so I will now take you to my homepage. As John mentioned, I do have a bit of a Twitter addiction. I've done a lot of tweets. You can see I don't walk the walk in that I haven't actually got around to putting up a nice photo on my when Twitter changed your profile page to give you access. So I've just got the blank. Don't do what I'm doing, get a nice photo or something that says about who you are on your Twitter page. Yeah. And I thought I should be putting up something that says croaky. Have you got that page okay? Let's see.
Yeah, it's just come up. Yeah.
And you'll see, great, I'm not an egg. A lot of people just use the avatar that Twitter gives them on Twitter and it shows up as an egg. And I think that's quite off-putting, impersonal. The advice generally is to put up a photograph. If you're not comfortable about that, some people may have privacy or other concerns, you can use a photograph of an image or something, that relates to you or your work. I've put up the avatar for Croaky because, this is very much about getting the news out around public health. You can also see in the description there, I've put some thought into describing, who I am and why I'm here. And I think when you're working out how to describe yourself in your little Twitter bio, really think about, who do you want to connect with? What service you can provide to people so that they will want to follow you, basically. So, are you sharing news about health services research or a particular area of that? Include a link, whether it's to your research page or your the association page or whatever, but have some links so that people can go and verify who you are and your bona fides. So that's just some things about thinking about, how to, it's really like your window to the world in the sense. It's how the world will come to see you because that is the reach of Twitter. Okay, so I'll just take you through some of I guess the fact that Twitter is so open is one of the reasons it can be so powerful, those open networks. And so, if you're getting started and you're wondering who to follow, you can identify the leaders in your field and go in and see who they're following, for example. So as you can see there, I've got nearly 12,000 followers. Anyone can go in and click on who they are. So we'll do that. And, I find this quite useful because it gives me some feedback about who is following me. And sometimes, when someone starts following me, I want to start following them. So, and I think when you're getting going, it's a good idea to be reciprocal like that, to follow people who are following you, and it can help, get you started. That said, I think it's a mistake. A lot of people focus on, how many followers have you got, as if that's the only indicator of Twitter impact. And I think that can be a bit of a mistake because you can use Twitter very effectively simply as an aggregator of content. And I always say it's not necessarily the quantity of followers that you have, but the quality. So you might have a small number of followers, but they're all the people that you want to be reaching in your field. So just looking quickly at this, can everyone see as I scroll up okay? So this, there's individuals, there's an NHMRC funded research group, there's an Aboriginal boarding school, there's someone who suggests they're from South America. Australia Post started following me yesterday for some reason. So, it's just very interesting. You get a sense, of the potential breadth of reach of Twitter. And for me, I think that's why it's so powerful, because, when you work in a field, you get very used to talking to people in your field, and it's often innovation and new ideas often come from fields and spheres intersecting. So I think Twitter really bridges a lot of the silos that we have, both within health and between health and other fields. So that's just scrolling through, you can go and look later if you're interested. So now I will just go to who I'm following on Twitter, more than 2,000, which, as you can imagine, means that my Twitter feed can be very, it's prolific. It's going all day. There's news there all day. So has that come up okay on your screens? Sarah, you can see that?
Come up, yeah.
Okay, so that's who, yeah, great. So just to go through there, for example, the World Medical Association started following last night or yesterday. Someone from Choice, a public health student from Melbourne, different health and medical groups, journalist Monica Attard, Aboriginal Health Council of South Australia, a range of people. So you can go into other people's Twitter feeds and see who they're following, and then if it looks like they're going to be of interest to you, start following them. There's Mark Harris, very well-known primary care equity researcher. So really, I regard Twitter, or I approach Twitter as like my own personal communications, broadcasting channel, although it's much more than that. There's a politician following, Patricia Cavalis, ABC, Radio National. So you can see, the reach potentially of these tweets that I tweet and send out. Of course, that's not to say that every tweet you send out is seen by everyone who's following you. Not at all. Okay. Another thing you can do with Twitter when you're going through the feed is to favourite tweets. It's a way of bookmarking, something you might want to go back to, but it's also a way of interacting with people. And, just because I favourite a tweet doesn't mean it's my most favourite tweet or that I like it. I might favourite a tweet because it's really annoying, but I want to go back and read, whatever it is they're referring to. But when I favourite a tweet, the person who tweeted it or retweeted it will get a notification that I've done that. So, it creates interactions. And if you're interacting with someone, most days over a long period of time, you do actually, strange as it may sound, build up, relationships. And I've developed a lot of relationships via Twitter that have been incredibly helpful for my work as a journalist, also, doing research. And also just personally, I've made friends on Twitter as well. So these are some of the tweets that I have favorited recently. So that's one by Mari McInerney, who's a colleague, a journalist who co-moderates Croaky with me. And you can see she's tweeted out there the Law Society's platform for the New South Wales election. You can see she's using the hashtag New South Wales Votes, because that's a way of bringing that tweet into the whole stream of those tweets using that hashtag. She's included the link to their thing, to their policy platform, and she's got an image there too. There is some evidence that if you include an image with your tweet, whether it's a photo of someone or an image from a document, that it will get more retweets and go further. So that's something to know. Now, these are some tweets, just continuing scrolling down in my favourites, that I favorited this morning because I thought they might be of interest for this talk. And you can see from the hashtag there, this is a regular chat. That hashtag stands for National Health Service Social Media. So it's a group of people in the National Health Service in UK who are interested in using social media to improve healthcare. So, you could join in this group with them and get ideas from their discussions about how you and your members might use Twitter. And just the fact that this discussion happened online previously doesn't mean it's too late for you to join in. You can go in and reply to some of these tweets and engage with some of the people who are tweeting to get ideas. So you can just see, you know, how instant and easy it is to reach out to people on the other side of the world and learn from what they're doing. And the NHS, you know, my perception is they've been really quite progressive in trying to use social media, or sections of the NHS have, to improve healthcare. So there's someone saying, I advocate creating a Twitter list of people in your organisation and displaying their tweets on screens in foyers and canteens. I mean, I just thought, what a great idea. You can really have the people in your organisation, you know, their conversations, what they're sharing, being shared much more widely. And you know, I was quite excited by that. And, you know, obviously there's potential risks to that as well. But I always remember a quote around the use of social media by health professionals, you know, where there's been a lot of concern about the potential for risks out of using social media in a health professional context. And, you know, someone who said, well, you know, they trust us to save people's lives or to care for very sick people. You know, why can't we be trusted with social media? So I think, you know, that's my response. I think organisations have to, I guess, take some risks, trust people, and learn a little bit as we go. So here's some other suggestions. There's a Twitter account to follow social media in the NHS. Have you thought about feeding content like Tweet of the Week into a weekly email? So again, you know, something that you could do as an organisation as well to promote your members who are tweeting. Include some of their tweets in your publications or embed their tweets on your website. There's someone saying, I send a lot of screenshots to colleagues to show what conversations, feedback, links are happening. And that's sort of making the point, I think, that, you know, if you're not engaging in this space, you really don't know how much you're missing out on. You know, and that two tweets down, there's another comment. How many of us have used the phrase, the conversations are already happening, it's better to be a part of it? Retweet if yes. And another tweet in this that I thought is relevant for a group like yourselves, who I'm sure are all extremely busy, overcommitted people. There's someone saying time management is really a misnomer. The challenge is not to manage time, but to manage ourselves. And I think that is, you know, one of the concerns that really comes up in people's mind about Twitter, that it can seem very overwhelming. It can seem like it will use a lot of time. And, you know, I'm sure people felt like that when the idea of emails came in and people were used to dictating letters or something, you know, instead of writing emails themselves, that these sort of transformative disruptions can be quite challenging to establish ways of practicing, but often they end up substituting a little bit as well. So it's not like they're all a complete add-on on what you do. Sometimes they will actually substitute for other things. Okay, now while we've been talking, well, I've been talking, you can see up on the top of the screen here, is that showing up notifications? You can see that?
Not yet.
That's what I mentioned. Yep, you can't see it?
Yeah, we can see you.
Bring the screen. I'm pointing at notifications there, and there's a little number that says 5. Is that coming up?
Yes.
Okay, great. So that is, as I mentioned, you know, your connect feed or your mentions feed is very important on Twitter to keep an eye on, because that is, things are showing up in your notifications feed when people are mentioning you. So they're putting your Twitter handle or Twitter name into a tweet, when they're retweeting you. So if you're not paying attention to that feed, you can miss people who are having conversations or wanting to have conversations with you, or who are having conversations about you. And it also gives you some useful feedback in terms of who is tweeting, you know, what out of your Twitter feed. So, okay, so I've just opened my notifications feed. Can you see that, hopefully? Yep. So just to scroll through that. So that's telling me that, you know, 2 people have retweeted one of my tweets, which was to say that if you're not following We Public Health, which is a Twitter account this week, you are really missing out. There's great tweeting happening from Gemma Jacklin on breast cancer screening. And Gemma is a researcher at Sydney Uni doing research around breast cancer screening. I can see there that Matthew Cook from Nacho has favorited a tweet that I was mentioned in. I can see a list there of 13 new followers, so I can go in and see who they are, see who is, you know, interested in what I'm doing. Some of them we've just looked at because they're my recent followers. Oh, and there's Emmanuel. Hello. I'll say hello back to you later. It's very nice of you, Emmanuel, to say I'm a pro, but I'm not really, you know, I think I actually use Twitter at quite a basic level in that I'm not using, you know, apps, and I don't use Twitter lists much, although I'll show you some of them. I sort of like the chaos of all the tweets coming into my stream. And there's Aboriginal Health Council of South Australia saying please join the discussion on Close the Gap today, and they've got a hashtag in there, so if you're working in Aboriginal health you can join that discussion, use the hashtag. And there's Erica. Hello. Hello, Erica, nice to see you as well, saying hello. So, you know, later on I can go in and retweet some of these tweets from Erica, and that will help get out the word of the webinar as well. So that's just to give you an idea of the importance of following your notifications or Connect feed. Depending, I'm just showing you Twitter on my website now using the Twitter browser, but there are various apps and they're all a little bit different in how these functions come up and show. So it's really just a way, you know, you really just need to find your way around a little bit depending upon which app you're using, but the basic functions are the same.